Human salivary glands produce between 0.5 to 1.5 liters of saliva daily, facilitating mastication, swallowing, and speech, lubricating the oral mucosa, and providing an aqueous medium for taste perception. They also participate in the digestion of triglycerides and starches by secreting lipases and amylases. In addition, saliva plays a protective role against infections via its many organic constituents. Salivary glands based on size and location, salivary glands are classified as major salivary glands parotid, submandibular, and sublingual. Minor salivary glands are labial and buccal, glossopalatine, palatine, lingual, anterior lingual gland, glands of Blandin and Nern, posterior lingual serous gland, von Ebner's glands, posterior lingual mucus gland. Based on secretion, they are classified as serous, mucus, and mixed. Salivary glands are made up of secretory acini and ducts. There are two types of secretions, serous and mucus. The acini can either be serous, mucus, or a mixture of serous and mucus. A serous acinus secretes proteins in an isotonic watery fluid. A mucus acinus secretes mucin lubricant. In a mixed serous mucus acinus, the serous acinus forms a serous demilune around the mucus acinus. The secretory units merge into intercalated ducts, which are lined by simple low cuboidal epithelium and surrounded by myoepithelial cells. These ducts continue as striated ducts. These have a folded basal membrane to enable active transport of substances out of the duct. The parotid gland is the largest of all the salivary glands and weighs about 15 to 30 grams. It is located below the external acoustic meatus between the ramus of the mandible and the sternocleidomastoid. It is divided by the facial nerve into a superficial and deep lobe. The superficial lobe, overlying the lateral surface of the masseter, is defined as the part of the gland lateral to the facial nerve. The deep lobe is medial to the facial nerve and located between the mastoid process of the temporal bone and the ramus of the mandible. An accessory parotid gland may also be present lying anteriorly over the masseter muscle between the parotid duct and zygomatic arch. The parotid duct, also known as Stenson's duct, secretes serous saliva and opens into the vestibule of the mouth, gingiva buccal vestibule, opposite the crown of the upper second molar tooth. The submandibular gland is the second largest salivary gland, also known as the submaxillary salivary gland, weighs about 7 to 16 grams, and is almost the size of a walnut. It is situated in the submandibular triangle, which has a superior boundary formed by the inferior edge of the mandible and inferior boundaries formed by the anterior and posterior bellies of the digastric muscle. The gland is approximately J-shaped, being indented by the posterior border of the mylohyoid, which divides into a larger part superficial to the muscle and a smaller part lying deep to the muscle. The submandibular gland duct, also known as Wharton's duct, is thin-walled, about 5 centimeters long, and runs forward above the mylohyoid muscle lying just below the mucosa of the floor of the mouth in its terminal portion. The duct opens on the floor of the mouth, on the summit of the sublingual papilla, also called the caruncula sublingualis, lateral to the lingual frenulum. The sublingual gland is the smallest of all the 3 major salivary glands that is almond-shaped and weighs about 3 to 4 grams. The gland lies above the mylohyoid, below the mucosa of the floor of the mouth, medial to the sublingual fossa of the mandible, and lateral to the genioglossus. It comprises one main gland duct with various small ducts. The main duct, Bartholin's duct, opens with or near the submandibular duct. Several smaller ducts, the duct of Rivenus, open independently along the sublingual fold.
Thank you for watching.